Oh, this one's for my baby. Oh, yeah. Oh, 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 this one's for my baby. Oh, 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 this one's for my baby. Thinking back how my life used to be and all the mistakes I've made. Took a lifetime to find this is right, but girl, you made it work so.
You can be the greatest, you can be the best, you can be the King Kong banging on your chest. You can beat the world, you can beat the war, you can talk to God, go banging on his door. You can throw your hands up, you can beat the clock, you can move a mountain, you can break rocks. You can be a master, don't wait for luck. Dedicate yourself and gonna find yourself standing in a hall of fame. And the world's gonna know your name, 'cause you burn with the brightest flame. And the world's gonna know your name, and you'll be on the walls of the Hall of Fame.
You can go the distance, you can run the mile, you can walk straight through hell with a smile. You could be a hero, you could get the gold, breaking all the records you thought could never be broke. Do it for your people, do it for your pride. How you ever gonna know if you never even tried? Do it for your country, do it for your name, 'cause there's gonna be a day when you're
standing in a Hall of Fame. And the world's gonna know your name, 'cause you burn with the brightest flame. And the world's gonna know your name, and you'll be on the walls of the Hall of Fame.
You can be a champion, you can be a champion, you can be a champion, you can be a champion.
On the walls of the Hall of Fame.
Past failures may haunt you, you yourself may doubt you, but don't let none of it discourage you and stop you, block you from reaching your goals. goals. Just believe in your own capability, ability to aim for the stars. You will overcome this war. You'll be licensed to heal and be licensed to help. This is for your mama and this is for your papa. Know that pain is temporary, but your license
Standing in a hall of fame, and the world's gonna know your name, 'cause you burn with the brightest flame, and the world's gonna know your name, and you'll be on the walls of the hall of fame. You could be the greatest, you could be the best, you could be the King Kong banging on his chest. You could beat the world, you could beat the war, you could talk to God, go banging on his door. You can throw your hands up, you could beat the clock, you can move a mountain, you can break rocks. You can be a master, don't wait for luck. Dedicate yourself and gonna find yourself standing in a hall of fame. You can be the greatest, you can be the best, you can be the King Kong banging on your chest. You can beat the world, you can beat the war, you can talk to God, go banging on his door. You can throw your hands up, you can beat the clock, you can move a mountain, you can break rocks. You can be a master, don't wait for luck. Dedicate yourself and gonna find yourself standing in a hall of fame, and the world's gonna know your name, 'cause you burn with the brightest flame, and the world's gonna know your name, and you'll be on the walls of the hall of fame.
You can go the distance, you can run the mile, you can walk straight through hell with a smile. You could be a hero, you could get the gold, breaking all the records you thought could never be broke. Do it for your people, do it for your pride. How you ever gonna know if you never even try? Do it for your country, do it for your name, 'cause there's gonna be a day when you're
standing in a hall of fame, and the world's gonna know your name, 'cause you burn with the brightest flame, and the world's gonna know your name, and you'll be on the walls of the hall of fame.
You can be a champion, you can be a champion, you can be a champion, you can be a champion.
The walls of the hall of fame.
Past failures may haunt you, you yourself may doubt you, but don't let none of it discourage you and stop you, block you from reaching your goals. Just believe in your own capability, ability to aim for the stars. You will overcome this war. You'll be licensed to heal and be licensed to help. This is for your mama and this is for your papa. Know that pain is temporary, but your license
Standing in a
will
hall
never.
of fame, and the world's gonna know your name, 'cause you burn with the brightest flame, and the world's gonna know your name, and you'll be on the walls of the hall of fame. You could be the greatest, you could be the best, you could be the King Kong banging on his chest. You could beat the world, you could beat the war, you could talk to God, go banging on his door. You can throw your hands up, you could beat the clock, you can move a mountain, you can break rocks. You can be a master, don't wait for luck. Dedicate yourself and gonna find yourself standing in a hall of fame.
Good morning, baby G's, and good morning to to students who are watching via the Top Notch portal. So, naka-live stream tayo ngayon, guys. So, kindly get your quiz sheet and Mongol 2 pencil. Okay lang naman kahit hindi Mongol. Basta number 2. So, guys, in life, diba, may chance pa rin yung number 2. Minsan, napipili pa rin sila, diba? So, yun. Walang hugot doon, guys. Ano lang natin dyan ay number 2 pencil lang talaga ang kailangan for the board exam. So before we start our session for this morning, let us all put ourselves in the holy presence of the Lord, in the name of the Father, and of the Son, and of the Holy Spirit. Amen. Dear Heavenly Father, we thank you for giving us another wonderful day full of hope and positivity as we prepare ourselves for the upcoming October 2023 Physician Licensure Examination. Please continue to give us the strength to persevere and be consistent with our present endeavors. Shower us with more guidance, support, patience, and wisdom as we are now 2 weeks closer to our goal of becoming a licensed physician. Grant this through Christ our Lord. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. So guys, 2 weeks na lang, di ba? 14 days to go. So, ano talaga tayo? Guys, ready na ba kayo? You have your, quiz sheet and pencil. So, I'll show you first yung, answer muna natin yung 10 questions. Okay guys, before we start, meron akong trivia. So, did you know na you need 21 minutes, diba, to regain focus? So, ang ano ko lang dyan ay, focus na tayo for the Quizmaster. Huwag muna tayong multitasking. Actually, medyo pinalitan na nila yung term. Task shifting na yung tawag nila dyan. So, dahil dyan, ito lang ang focus natin. Game na ba? So, for those who are watching via Top Notch portal, so ito na, let's begin. Number 1. Question number 2. Question number 3. Question number 4.
Ma'am, hindi po ata siya naka-share screen.
Hindi ba ba? Ay, wait. Sorry. Ulit. Sorry, ako yung na-excite for you guys. De, ano lang yan, practice. So, eto, totoo. Game? Eto, can you see the slide?
Yes, ma'am. Okay na po.
Okay, thank you. Question number 1. Question number 2. Question number 3. Question number 4. Okay, question number 5. Question number 6. Question number 7. Question number 8. Question number 9. And question number 10. Okay, so that's our 10-point quiz. So this morning, our quizmaster for this morning is a graduate of UST, Faculty of Medicine and Surgery. He ranked 7th during the October 2022 Physician Licensure Examination. Everyone, let us all welcome Dr. Neil Steven Cachella. Good morning, Doc. Steven.
Good morning, Doc Amy. Good morning,
Good
doctors.
morning. Doc,
Hopefully,
Amy, share
okay.
your screen. Pwede na.
Na nag-suspend yung other cities ng class today. So, kaninong place ba yung while I'm sharing screen, usap tayo. What place ba yung malakas yung ulan right now? Baka mahirap makinig ng Quizmaster, nasa bed pa yung iba. Diba? Okay. So, since you finished answering the 10 questions, let's jump right in. It's okay with me if you wanna eat and everything.
Doc Steven, just some few reminders, no? Once you flash the question, I will be releasing the poll, and then yung mga students will have around 20 seconds to fill in yung poll natin. Then
Okay.
after which, I'll be sharing the poll. Kindly give yung percentage of their answers.
All right.
Yun. And then we can proceed with the discussion. Okay?
Yes, Doc Amy.
Okay, thank you.
Thank you so much. Okay, so let's start for the first question. It was a case a while ago. Actually, it was most cases. There you go.
Guys, can you input your answers?
Okay, so we finished the 20 seconds for you to answer, guys. So from this question, those who answered most is letter D, followed by letter A, letter D at 74%, letter A at 16%, letter B at 7%, and yung least is letter C at 3%. So I'm happy na ito yung brain stimulator natin for today. It's just a simple question, but you were able to answer it correctly. Okay, so for the next slide, sorry, let's proceed first to the rationalization already. Okay, here we go. So that was the answer a while ago. That was the question a while ago. And the answer for this one is letter D. So what do you think? So mga keywords, let's go immediately to the keywords of this particular case. So it's important na sa board exams, there may be cases na mahaba. So scan through it first, read the question, and then go read everything in detail. So here you can see there's a carbuncle, incision and drainage. So you think immediately that it's a purulent material that was removed. Diba? So most of the time naman, mga abscess, yung mga ginagawa ng incision and drainage. So ano ba yung most common organism? You think of Staphylococcus aureus or Streptococcus pyogenes. Pero which of those from the choices yung may ganyan? So here you can see letter D is Staphylococcus aureus. So that's gram-positive cocci in clumps. But what are those other choices? So most commonly, the gram-negative cocci in pairs, we saw this in the urethral swab for Neisseria gonorrhea. Diba? So, syempre, if in places na wala namang NAAT or any PCR testing, pwede naman nilang screen by urethral swab of the pus, and they will be doing gram staining and seeing those gram-negative cocci in pairs. Followed by letter B. Although that letter B is commonly seen in most bacilli, and later I will be showing the exception to that one. So, most common bacilli that we know, E. coli causing UTI. And letter C, gram-positive bacilli in singles. What we know about it is, example would be the Bacillus species. So ano ba yung important in this particular question that needs to be remembered? So it's the gram staining pattern. So fast lang na review. In gram staining, it's VS. So your primary stain as crystal violet, more than, which is iodine. So anong purpose ng more than? That intensifies the primary stain, which is crystal violet. And then, depending on the gram positivity or gram negativity of the organism, the decolorizing agent may remove the color if it's gram negative. So look here. In the screen, the decolorization would reveal gram negative as colorless. So be careful. The question in the board exam may ask you, what is the color of a gram negative organism after applying alcohol or after decolorization? So the answer should be colorless. Okay? But the gram positive, because of the thick peptidoglycan layer, it remains to be violet. Hindi siya na decolorized. And lastly, because your gram negative has already been decolorized, when adding the counterstained safranin, that will result to a pink organism that will be seen under the microscope. But of course, the gram positive remains purple. So tingnan mo yung crystal violet dito, naging intensified. Crystal violet, naging intensified na naging violet na talaga siya. Okay? So, ano yung sabi ko kanina? This is a generality of gram staining. I'm not sure if it's in your handouts, but I have been using this since I was in medtech. And I would like to say na ito yung part na kinuha ko lang to sa internet. When you search generalities of gram staining, ito yung lumalabas. Okay? So, most cocci are gram positive except the following. So, pinakakilala among these three is your Neisseria. Okay? So, yan yung letter A na option kanina. And then, for bacilli naman, yung general rule is most of them are gram negative, except for black men. That's from the internet mnemonics. But for me personally, what I do, ano ba yung usual na naalala ko? Sila yung ending in us, so that's bacillus and lactobacillus, and ending in U. Bifidobacterium, Corynebacterium, Mycobacterium, and Clostridium. The rest, okay na yan, kahit hindi ko maalala. For me lang ha. But if you want to use this one, black men, by all means, you can use that one. Para lang for the board exams. Okay? So I think that ends for number 1. We can proceed with number 2. Okay, 20 seconds is up. And I'm happy to see that most of you answered correctly. So the option A is 71%, letter B is 12%, tied with letter C also at 12%, and lastly with letter D, which is 5%. So let's continue. So what is this question? What is the correct answer? So the correct answer for this one is letter A. So it contains an endotoxin composed of lipopolysaccharide, which induces TNF and interleukin-1. So fast lang, gram-negative bacteria. Pagkabasa mo ng letter A, ano yung naisip mo kaagad? Di ba? Endotoxin. Is that gram-negative or gram-positive? Yung palatandaan ko dito, endotoxin. So N. So that's negative. Pag exotoxin, letter X, tilt mo lang ng kaunti, parang letter T na siya. So that's parang plus sign. So for me, that's how I remember yung generalities about endotoxin and exotoxin. So for the rationalization, comparing muna the two of them. Di ba? I mentioned kanina sa previous rationalization ng number 1. The gram-positive cells has a thick peptidoglycan. That's why it's not being decolorized after the alcohol part of your gram staining. And thicker, and the teichoic acid is present. So again, di ba? Exotoxin, parang X. Then dalawang T. Positive, has thick peptidoglycan, and has teichoic acid. So T na yun. Okay? Sige. And then ano naman yung meron sa gram-negative cell? Siyempre, if it's thicker here in gram-positive, definitely thinner naman yung sa gram-negative. If meron dito, most probably sa gram-negative, walang teichoic acid. But ano yung sabi natin? Negative, letter N, endotoxin. So endotoxin is composed of what? It's actually your lipopolysaccharide. So in here, there's your lipopolysaccharide. So yes, it's contained in gram-negative. And the difference between the two then, na makikita mo, look here. There is an outer membrane for the gram-negative and an inner membrane. The inner membrane is actually the cell membrane already. So between that outer and inner membrane is your peptidoglycan layer. So in this space is your periplasmic space, which can be seen in gram-negative organism. So important for that is nandyan yung antibiotic resistance enzymes that can be seen, that is used by the organism to counteract antibiotics in the body. Okay? So now let's proceed to number 3. Okay, 20 seconds is up. So you notice that it's again a case. Mahilig ako magbigay sa inyo ng case because sometimes na kinakabahan tayo pag nakakita ng case. But most of the time, those cases, you've already read about it since 2 weeks na lang tayo sa boards, and definitely mas confident na kayo as when you started already. So for this particular question, the correct answer is letter C. And I'm happy to say that 77% of you got the correct answer, followed by letter A at 10%, letter B at 9%, and lastly by letter D at 4%. So sana naman sa board exam, walang mag-a-answer ng letter D for this question ha. We've already made a sample of this one, and the answer again is letter C. So ano ba yung case na to? Merong fever, may migrating joint pain si Mariela, may nodules din, then recurrent sore throat. Then ayan, giveaway, enlarging tonsils with white material every time. So you think of purulent tonsillitis. So ano ba yung usual cause ng tonsillitis? It's your Streptococcus pyogenes. So important to note here, ano ba yung case na pinakita kanina? So that's your, yung fever, migrating joint pains, and nodules. You can answer in the chat if you want, but with time, I would say it already. Okay? So the answer would be acute rheumatic fever. So in this particular case, in Streptococcus pyogenes, the spectrum of disease may not just be acute rheumatic fever and glomerulonephritis, because these two are part of your immunologic. So sila yung delayed because of the antibodies being created after the infection. But acutely, ito yung makikita, pyogenic and toxigenic. Pyogenic, from the name itself, it creates a purulent material during the disease process. Commonly, that's your pharyngitis. Okay, yung sa case kanina. But other examples would be skin infection. So impetigo, erysipelas, cellulitis, and more severely, it's your necrotizing fascism. Then toxigenic, because it creates what? Toxins. So scarlet fever and streptococcal toxic shock syndrome. So comparison lang, yung streptococcal is less severe compared to the one that is caused by your staphylococcal toxic shock syndrome. So brief lang overview. For acute rheumatic fever, it is possible after what? After pharyngitis. So palatandaan ko niyan, di ba? Sabi natin kanina, pwedeng pharyngitis, pwedeng skin infection for strep pyogenes. Yung heart, malapit siya sa pharynx. So although alam naman natin 'di ba na antibody yung reason kung bakit nagkakaroon ng acute rheumatic fever, but for me, ano yung nagko-cause na precedent infection na nagli-lead to acute rheumatic fever? So that's your pharyngitis kasi mas malapit siya sa heart. Okay? Pero yung glomerulonephritis, ano yung pwedeng mag-cause? Isipin niyo na lang, all blood 5 times siyang bumabalik-balik. Your blood circulates 5 times to your kidneys every day. It's being filtered 5 times. So any infection, whether it's in the pharynx or in the skin, will cause or may possibly cause glomerulonephritis. So yun yung palatandaan ko palagi. Yun lang yung mga nirarasyo ko sa utak ko. Ano ba yung dapat pwedeng possible mangyari? Okay? So both, you can see, it's the M protein, the antigen, that incites the immune reaction causing these two diseases, acute rheumatic fever and glomerulonephritis. One thing to note lang din is the evidence of infection. This one is important kasi ano ba yung gagamitin mo if meron kang usual skin infection? It's anti-DNAs. And what if pharyngitis yung patients? It's anti-streptolysin O. Why? It's important here in the Jones criteria because here sa pinakababa, you need evidence of infection. Okay? And then, two major, sorry, na-delete siya. It's 2 major or 1 major plus 2 minor. I know na doon sa ating sa handout, I don't know if it has been edited. but nakalagay doon PEX yung palatandaan. But for me, what I use is axis. Bakit axis? Kasi A is arthritis or algia or pain lang, hindi siya inflammation. Then 2 is carditis. 3 and 4, chorea, Sydenham chorea. 4 is erythema marginatum. And 5 is subcutaneous nodules. Kaya ako may last S because that is being caused by your Streptococcus pyogenes. Doc, bakit naka-bold yung 3 and 4? Because in the past, this 2 is said to be standalone criteria. Like they can stand alone as a criteria for diagnosing Jones criteria. Then, Doc, ba't mo pinalagay pa yung table? Because for me, as you noticed here, yung algia at arthritis, if it's in low-risk population, kailangan talaga na inflammation yung nakita. Pero if high-risk na yung patient mo, tingnan mo, kahit algia lang yan, polyarthralgia, that may suffice already as a criteria, a major criteria for acute rheumatic fever. Okay? So arthritis, algia, that's okay. Just in case lang na lumabas sa boards ng ganun. Then makita mo dito, pag high risk na yung patient, mas mababa yung threshold for the minor criteria as compared to your low risk population. Okay? Okay, let's proceed to number 4. Okay, I think that 20 seconds is up. Before I proceed with this one, kamusta? Can you chat if you have any questions or clarifications? Or we can do it later. Okay, sige. Since I don't see any questions just yet. So let's proceed with number 4. Diba? Ang haba ng case. Pero, ano ulit yung tip for me? Scan through the question, go directly to the question first, and then read in detail. Okay? So, kanya-kanya tayo ng trip kung paano natin tackle yung ganitong kinds of questions na sobrang haba. Pero as you noticed, ang mga keywords dito, productive cough, for how long, Doc? Okay, di ba? Yung alam dapat natin, kailan po nag-start, ma'am? Kailan po nag-start, sir? So, kanya, 6 weeks. And then, what are the associated symptoms? May sweats, pag natutulog, so night sweats. Then, loosening of clothes, that's indirect saying na may weight loss. And lastly, alam mo na yung diagnosis, di ba? Most likely, in the Philippines, alam na natin kung ano yung most likely organism. So, ano yung tanong? Growth and oxygen requirements. Okay? So, most of you got it correctly naman at 72%. Obligate aerobe is the answer. Because ano ba yung organism na ito, if ever? 75, sorry. Letter C is 75%. Everyone got, 75% of you got the correct answer. 18 for choice A and followed by letter B and D at 4 and 3% respectively. So most of you got it correctly. So although parang overwhelming yung question, the answer is obligate aerobe. Kasi ano ba to? It's a classic case of tuberculosis. Di ba? Ano ba yung 4 criteria ng tuberculosis? Chronic cough, but usually pag chronic, you'd say it's more than 4 weeks or 8 weeks. But in the Philippines, 2 weeks is already considered as a chronic cough. Chronic cough, night sweats, pwedeng magka-chills, pwedeng magka-weight loss. Then mas give away pa if sasabihin, the patient has hemoptysis. Di ba? Okay. So if we proceed now, so ito yung pinakita ko kasi ito yung table na medyo hindi mo papansinin doon sa handout. Kasi obligate aerobes, dami naman yan. Baka naman malalaman ko siya eventually. But ano yung palatandaan? As you can see here in the next slide, although galing to sa top notch, you can tweak it as you like. Pero ako, nagustuhan ko to kasi obligate aerobes, meaning kailangan ng oxygen. Yung starting pa lang nosy. So, di ba? Saan ba pumapasok yung hangin? Di ba sa ilong lahat? So, pwedeng noisy and nagging, pero for me, niretain ko yung nosy. Nosy and nagging pets must breathe lots of oxygen. So, mailong na mga pets. Ano ba yung meaning ng nosy and nagging pets? It's your nocardia, neisseria, Pseudomonas, Mycobacteria, Bordetella, Brucella, Bacillus cereus, and Legionella. But for me, anong tinandaan ko dito? It's this three, yung Neisseria, Pseudomonas, and Mycobacteria. Doc, bakit yung tatlong yon? Kasi for me, those three are the ones na most likely gagawa ng question. Sabi ko, paano nila gagawa ng question yung Nocardia, yung Bordetella, Brucella, or Bacillus, or Legionella? Parang hindi naman siya ganun ka-common. Unlike if Neisseria, lalagay lang nila, there's a purulent material coming from the urethra. Then yung itatanong pala is yung growth and oxygen requirements. Or yung Pseudomonas, sabihin nila, may greenish pus coming from the wound, or there's a burn patient with greenish pus or greenish secretions. So pwedeng Pseudomonas na yan. And lastly, yung Mycobacteria is yung case natin kanina na pinakita, classic case, very common in the Philippines. It's your tuberculosis. Okay? So ito, in contrast naman, ano naman yung palatandaan for obligate anaerobes? Okay, may binigay tayo sa handout, yung cannot breathe fresh air. Okay? Pwede mong tandaan. For me personally, tinatandaan ko dito, A, B, C. Kasi, I mean, I don't know, but it works for me ever since. Pag anaerobes, hindi ko na alam, A, B, C na lang. So that's your actinomyces, bacteroides, and your Clostridium. Okay? So, here naman, gusto ko lang i-point out, pwede niyong tandaan din, yung sa microaerophiles, it's usually ending in bacter. Campylobacter and Helicobacter. And sa microaerophiles, sinatandaan ko siya kasi nandyan yung common na favorite, yung sa treponema, causing syphilis. And ano yung common? Ito yung medyo nagulat ako, talaga, Streptococcus is microaerophile. Although, others would label this as aerobes din pa rin siya, hindi siya microaerophile. Okay? Okay, so hopefully that's clear. Ayan. So ito, may dinagdag ako na part. So what if yun, Mycobacteria? Fast answers lang. You can answer in the chat if ano tingin nyo na answer. So gene expert from the patient is MTB detected. So you do a procedure. Resistance to what medication can be detected by the same test? Can anyone write the answer in the chat box? Ayun, very good. So fast lang. Rifampicin. That's correct. The answer is rifampicin. So another one. What is the appropriate treatment regimen for this patient? Appropriate treatment regimen. Okay. I saw the correct answer already. It's regimen 1. So ano yung regimen 1? Can you fast lang, fast chat. Anong regimen 1? Ayan, very good. 2HRZE, 4HR. So there you go. So we have two regimens, di ba? Regimen 1, 2HRZE, 4HR. That's all the tuberculosis cases except for the bones, joints, CNS, bones, and joints, whether it's new or retreatment. So, ginamot man siya before or bagong newly diagnosed case, same lang. Regimen 2, it's the exception. If it's an extrapulmonary TB of the CNS, bones, and joints. But ano dito yung binibigyan, anong tuberculosis cases yung binibigyan ng steroids? Can someone answer from the poll? Although hindi ko nagawa ng parang gusto ko lang siyang i-add. It's actually your tuberculosis of the brain and alam ko brain and bone. Heart and bone. Okay? Heart and bone. Kasi kailangan mo bumaba yung inflammation para pericarditis and Pott's disease. Yung kailangan ng steroids para bumaba yung inflammation. Yung sa bone naman is usually sa back siya para hindi siya mag-compress sa spinal cord. So, ito, dinifferentiate ko lang new case and retreatment case. Kasi ito yung itong tatlong naka-bold na to, yung may contention. If it's new case, it's anyone na newly diagnosed, wala pa talaga siyang medication na tinitake, or it can be considered if it's less than 1 month. So, example, yung patient mo, binigyan mo ng 2HRZE4HR. Pero ininom niya lang for 3 weeks. Then bumalik sa'yo. How would you treat the patient? How would you label it? It's still a new case kahit naka 3 weeks siya. So kapag retreatment naman, it's anyone na may at least 1 month. 1 month or more of previous TB medication. So dyan na papasok yung mga labels na to. Then relapse, differentiating is under retreatment case. Dati na siyang ginamot, na-diagnose na siya na completely eradicated yung TB, but currently, meron siyang ulit active tuberculosis. So that's the relapse. Pag retreatment and relapse may sound synonymous, pero there are other retreatment cases. So ito yung other retreatment cases. So ayun lang, baka lang lumabas. Okay? But yung mga question kanina, yun yung mga important parts. Let's proceed with number 5.
Doc Neil, this is Dr. Banzuela. Yung space for your talking head when we go live, part ba talaga yan ng PowerPoint mo or is it a bug in our software?
Sorry, Doc, I was not able to remove this one po. Thank you.
Sige,
Kasi
nakabala ko, akala ko sa Zoom or something eh.
Tinanong ko siyang ano, sabi ko just in case baka ma-block pa yung question.
Sige, sige.
Okay, thank you so much, Doc.
Everyone, pasensya na ha. Okay, akala ko kasi sa Zoom eh. Papaayos ko sana. Thank you. You're doing a very good job, Neil. Continue.
Okay, thank you, Doc. So now, I understand. Sorry, napindot ko kanina. So for those answering this one, there's a lot of confusion, di ba? Mga hindi pinapansin na tanong. So inad ko lang just in case lumabas. Okay? But it does not mean na you're not prepared for the board exams. Okay? So most of you answered letter D. So it's a trap, guys. It's a trap. 43% of you answered letter D, followed by letter C at 28%, and letter A at 17%. Unfortunately, the correct answer is the one with the least number of percentage. It's 12% only. The answer is letter B. Ba't ko siya sinama? Kasi personally, tinandaan ko siya nung nag-review ako ng boards. Kasi ano yung dalawang hindi mo pwedeng gawin sa Treponema pallidum? It's a favorite question kasi sa boards, yung syphilis. So sabi ko, sige nga, isama ko yung syphilis. Kasi feeling ko dito pinansin. Okay? So Treponema pallidum cannot be gram-stained because it's too thin and cannot be cultured in vitro or inside the laboratory because it lacks Krebs cycle enzymes. Okay? So kaya ko siya inad kasi ito yung dalawang hindi mo pwedeng gawin sa syphilis. So meron siyang other ways of diagnosing syphilis and other ways for you to know that it's syphilis. So most likely molecular, PCR, NAATs, ganun yung way to go. Or yung ano ba yung ginagawa natin? VDRL and RPR as screening and fluorescence treponemal antibody testing as a confirmatory testing. So nilagay ko dito microaerophile yung treponema and take note the number of stages sa Treponema pallidum. Treponema 4 stages. Pallidum 4 stages. Tandaan ha, 4 stages. So what are those stages? It's your primary, secondary, yan. Ito yung nahisingit na hindi madalas napapansin. Latent. Hindi natin na-discuss because syempre, walang symptoms yung patient. But it's one of the stages of your Treponema pallidum or your syphilis. And lastly, your tertiary stage. So, fast lang, primary. Tinatandaan ko, primary 1. So, kapag 1, isa yung tinatandaan ko palagi, chancre. Painless, hard, solitary nodule. Okay? Secondary, 2 words palagi. And 2 things that I remember. Palmar rash or maculopapular rash. So, 2 words, maculopapular rash. Pangalawa, condyloma latum. Okay? That's one way for you not to confuse it with gumas, which is here in tertiary. Paano ko tinatandaan yung tertiary? It's all ending with letter S. Neurosyphilis, aortitis, and gumas. But of course, syempre, may question tayo later about neurosyphilis. I'll be showing a slide. But here, you can notice that it's not just these active cases. There's a congenital syphilis. Anong palatandaan ko for congenital syphilis? It's letter I actually. So pwede kang sa mata, interstitial keratitis, sa ilong, snuffles or yung saddle nose, sa bunganga, yung Hutchinson's teeth, and letter I dito, it's your 8th nerve deafness. So yun yung palatandaan ko for congenital syphilis. Letter I ba or letter T? Okay? Dito sa mata, deafness, sa ears, deafness, sa mata, keratitis, sa ilong, saddle nose or snuffles, and sa bunganga, Hutchinson's teeth. So those are my mnemonics for myself kung paano ko tinatandaan yung common presentation of your congenital syphilis. O yan, yun yung sabi kong question. What stage is it possible? Di ba nasa presentation kanina, it's in the tertiary stage. Can someone type in the chat lang? Fast lang, kahit isa lang yung answer. Is it secondary, primary, tertiary, or all of the above? What do you think is the correct answer for this one? Secondary, tertiary, 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 secondary. Okay. Actually, they say that anytime it may, neurosyphilis may be present in those affected with syphilis. Like, pwedeng ma-affect yung brain kaagad. Pwedeng magka-neurosyphilis kaagad. So, it may be primary, secondary, or tertiary. Okay? Yun lang. Yun lang yung gusto kong i-highlight for this one. Okay. Let's proceed now with the next case.
Doc Steven, you're muted.
I'm sorry, I haven't noticed. Thank you so much, Doc Kimmy. So here, I'm happy that everyone, not everyone, but most of you got the correct answer. I understand yung confusion about letter A and letter D, but most of you answered letter D at 70%, followed by letter A at 23%, then letter C at 6%, and letter B at 1%. Okay? So ano ba yung tinatanong sa case na to? Bakit, Doc, yung answer letter D? So pet pug, may animal involved. Okay, si Evita. Then, ang nangyari, she noticed itchiness and serpiginous tracts underneath the skin. So, if ano ba yung naisip mo? If you have a pet pug, I mean, not just a pet pug, basta may pet, then serpiginous tracts, it's most probably a case of cutaneous larva migrans. So, ano ba yung nagkakos ng cutaneous larva migrans? It's your animal hookworms. Okay? Kasi yung letter B and C, those are your human hookworms. So they're able to penetrate the skin properly and invade the human host. But yung animal mo, na animal hookworm, Ancylostoma caninum, they are not, parang ano lang siya, they are not supposed to be inside the human host. Kasi animal hookworms nga siya. So most likely, na-contract ni Evita galing sa pet pug niya. So the two animal hookworms are your Ancylostoma brasiliense, that's your cat hookworm, and secondly, Ancylostoma caninum, your dog hookworm. It causes what? Again, cutaneous larva migrans. Kasi ano ba yung mode of transmission of your hookworms? We know that it's through penetration. So if makita nyo dun sa handouts, it penetrates the skin, yung hookworms. And ideally, pag human hookworms yan, like Cato americanus and Ancylostoma duodenale, after penetrating the skin, they enter the bloodstream and undergoes heart-lung migration. From the lungs, it's coughed out in mucus, and then it's swallowed by the person, yung hookworm, and then it's deposited in the intestines. That's why it's being released in the feces. Kaya nagkakaroon ka ng transmission to other persons ng human hookworms. But ano yung disease niya? Ground itch on first contact. Makate, yung penetrate ng hookworm. Low first pneumonia and Wakana syndrome is kapag may heart-lung migration siya. Okay? And then lastly, microcytic anemia and hypoalbuminemia kasi yung adult hookworms pwedeng kumagat sa intestinal wall mo and that would cause bleeding because they release anticoagulant. So kahit pagkagat nila, supposedly titigil yung bleeding but it's not possible kasi may anticoagulant yung pagkagat ng human hookworms in the intestines. Pero ano yung note dito? So human hookworms, ang dami nangyari. May heart-lung migration and everything. But animal hookworms, they're not supposed to be inside the human host. So they are not able to undergo the proper heart-lung migration that I previously explained. So they remain underneath the skin. Pag penetrate, hindi sila makapasok ng ng blood, sustain na lang sila doon sa skin mo. So ano mangyari? Gagalaw-galaw lang sila within your skin. That's why you're having cutaneous larva migrans, meron yung serpiginous tracts. Alright? So I hope that clears why bakit yung animal hookworms lang yung pwedeng magka CLM. In contrast naman, I added this one. Same principle. Pag human roundworm, Ascaris lumbricoides, it's the common intestinal roundworm. They're able to complete its life cycle inside a human host. But pag animal roundworm yan, Toxocara cati in cats and Toxocara canis in dogs, it undergoes visceral larva migrans. Kasi for me, although it was not written verbatim, if you think of the life cycle of these roundworms, kailangan niya din ng heart lung migration. So, pag pasok sa body ng animal roundworm, the larva wanders aimlessly. So, wala siyang pupuntahang proper organ. So, kahit san-san na lang. That's why it's called visceral larva migrans. Okay? Okay, let's proceed with the next question. Okay, 20 seconds is up again. So for this question, 50%. I'm surprised. 50% answered colonoscopy. That's letter B, followed by letter C at 34%, letter D at 9%, and letter A at 7%. So ano ba dapat yung correct answer? The correct answer is pag coconut cake rectum. I remember it before. I think it was already asked in previous boards, but in our boards, it was asked again. Ano daw yung may coconut cake rectum? It's your trichoriasis. Bakit? Ano ba yung disease na nangyayari in patients with trichoriasis? They may have rectal prolapse kasi nakakabit yung trichoriasis, your whipworm. Okay? So, ayan. Ano ba yung, kung may trichoriasis yung patient, what are the expected findings? Okay? So kapag digital rectal, pag letter A muna tayo. Let's do it pasunod. Stool exam, meron kang barrel-shaped eggs. That's the usual diagnostic stage that you can see in fecalysis. Followed by the correct answer, colonoscopy or the coconut cake rectum. I'll be showing a picture later to compare and contrast. Bakit coconut cake rectum? And letter C, digital rectal exam, nothing distinct. Hindi naman sa none. Pwedeng nagpag-digital rectal exam mo, then severe infection, pwedeng meron ka makitang worm. But of course, that's not always the case. Kasi naman yung patients already would seek consultation habang hindi pa sila ganun ka-severe. Okay? So digital rectal exam, nothing specific. Radiography, nothing specific din. Okay? So itong dalawa lang yung pwedeng diagnostic modalities. Pero coconut cake rectum, ano yung pwedeng makita, Doc? Ayan. Okay? I'm sorry for the one who posted this picture. I did not mean anything bad of having this one. Just wanna provide you with a visual aid kung bakit coconut cake rectum. So coconut cake rectum, so here, you can see here below, that's a colonoscopic picture of trichoriasis, a severe trichoriasis. You can see the small worms, the whipworms, that seems like coconuts. Then ito yung coconut cake sa taas. Okay? I'm sorry for destroying your appetite for breakfast. But I hope sana worth it siya. Lumabas siya ulit sa case nyo. Kasi nung sa amin, lumabas siya. It was a recall from a previous board exam. Kaya na-mention and nalaman namin about the coconut cake rectum. Pero ano yung point mo, Doc? Ba't mo pinakita yung dito? Like, ba't mo nilagyan ng red? Kasi for me, for example, hindi mo malaman before kung ano yung pwedeng makakita ng coconut cake rectum. Which among these modalities ba yung pwede mong makita yung rectum? Directly, na ma-describe mo as coconut cake. I think the one that can only visualize the rectum here is your colonoscopy. Okay? So that's why the answer here is colonoscopy. So here is just a quick tabulated form of the must knows for trichoriasis. So it's your whipworm, embryonated egg as infective stage, barrel shape, as mentioned, is its diagnostic stage in fecalysis, transmission through the fecal oral route. The disease, again, for the coconut rectum is the rectal prolapse. Although yung coconut cake rectum may be seen in colonoscopy kahit hindi pa nag-prolapse yung rectum. Okay? And then treatment is albendazole or mebendazole, but preference for mebendazole. So here, I just also included the mnemonics that needs to be remembered that includes trichoriasis or trichoris. So for me, the one that I usually remember for soil-transmitted helminths is the name itself, STH. Kapag STH, S stands for strongyloides, T stands for trichoris, H stands for hookworms, and dinadagdag ko yung most common dito sa Philippines, Ascaris lumbricoides, na makikita mo lang if you try to go to areas na nagpupupo sila sa side, pwede ka kumuha ng soil sample, it's possible that you can get Ascaris. Okay? So ano ba yung sa weird or unique sa trichoris? Its location is in the large intestines. Remember this too, kasi among the parasites, the roundworms, sila lang yung nakikita sa large intestines. The rest sa small daw. Okay? Then lastly, the unholy trinity. The unholy trinity is hookworms, Ascaris, and trichoris. If you try to search for that in the internet, it may show you microscopic pictures na sa isang micrograph, makikita mo yung tatlong eggs. So these two are the unholy trinity. If ever lang lumabas sa board exams. Okay? Let's proceed with question number 8. Okay, 20 seconds is up. So the answer is, ayan, madaming confusion about this one again. So most of you answered letter A, sporogony at 36%, followed by letter B at 30%, letter C at 24%, and letter D at 10%. So be careful when you're reading through these kinds of questions kasi yung tanong, bypassed. Ano daw yung di na dinaanan ng plasmodium when it entered the blood? Diba? Ano ba yung usual route? Okay? Okay, I'll be giving you the correct answer first. The correct answer is your exoerythrocytic cycle. Why? Bakit exoerythrocytic yung na-bypass or hindi dinaanan? So for us to discuss this one, it's important na ito yung makita. Okay? I'll just give a brief lang na background. So here, yung may red dots, ay red arrows, that's for your mosquito stage. The blue arrows for the human stage. Ano yung alam natin na transmission? Kinagat ng mosquito yung person. Pagkagat, syempre pupunta siya ng, yung first target niya would be your liver. So that is considered as your exoerythrocytic cycle if galing sa mosquito. So yung galing sa liver ng mga schizons, pumutok, kumalat yung merozoites towards your red blood cells. Now it enters the erythrocytic cycle. So humans, there's two stages. Exoerythrocytic in the liver, and once it ruptures, it enters the circulation, now part of the erythrocytic cycle. Sa erythrocytic cycle, pwede siyang maging schizon para kumalat ulit, or pwede siyang maging gamits na kakainin ng mosquito in its next blood meal. Then sa mosquito, magiging zygote siya, magko-combine yung microgamete for males and macrogametocyte for female to form a zygote, eventually ookinet, oocyst, and eventually sporozoites. So the effective stage in the normal cycle for humans is your sporozoites given by blood meal by the mosquito. Pero ano yung sabi natin kanina? It's blood transfusion. So saan? From the name itself, blood transfusion. Tingin mo saan siya dediretso? It's directly goes to the erythrocytic cycle. Okay? Hindi niya na kailangan dumaan ng liver kasi diretso na siyang pinasok sa bloodstream. So in that case, na-bypass niya yung exoerythrocytic cycle. Diretso siyang pumunta ng erythrocytic cycle. Okay? So yun yung na-bypass during that particular scenario. Kasi yung sporogony, that happens in your mosquito. Okay? So that's the answer. Why the answer is exoerythrocytic. Why the answer is exoerythrocytic cycle. The possible way of asking this one then, what is the step by which malaria develops when it's given through blood transfusion. So diretso na siyang erythrocytic. Hindi siya dadaang exoerythrocytic. Okay? Hopefully that clears everything about that particular question. Ito, dinagdag ko lang yan. So what is quotidian ba? Ano yung tertian? Ano yung quartan? So quotidian, every day, tumataas siya, every 24 hours. Tertian, every third day. So every 48 siya tumataas. Pero every third day. Kunyari, 1, 2, 3, o 3. 1, 2, 3, o 3, tumaas ulit. Ang quartan naman, every fourth day yung meaning. So 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. So hopefully that clears kung ano yung meaning ng quotidian, tertian, and quartan pattern in malaria. Because I've included this one. Okay? So, same table to na nasa handouts, but it's too much if we'll be discussing this one in Quizmaster. But one thing to note lang, iba yung shape ng gametocyte ng falciparum at siya lang yung may applique forms or may dalawang 1 to 2 dots in its ring form. And the one with the highest parasitemia and the one that can only possibly cause malignant tertian malaria. So itong falciparum. And what's unique for Vivax and ovale? It may deposit hypnozoites in the liver, causing relapse. Okay? Ayan lang. So let's proceed with question number 9. I'm so sorry, napindot ko yung ano. Ayan, napindot ko bigla. So the answer here is letter D, although you have answered it already din naman nung first part. The answer is correct, letter D, at 91%. Tama lahat. It's good. Na-scrape na yung bata, 2 minutes na dumugo. Definitely, hindi siya A. So 0% yung A, followed by B at 1%. And letter C, active vaccine, is actually correct as well. But tingnan mo yung question. What is the most appropriate management? So ano yung pinakatama? Because if you think of it, letter B is correct, you have to do that. Letter C is also correct, you have to give that to the patient. Because how do we categorize this particular patient? It's category 3. 2 minutes na yung bleeding, definitely mapapaisip ka na, di ba? Whether you need to give active and passive vaccination. So in here, in the table, it's just a complete table of what is category 1, what is category 2, what is category 3. So, fast review, yung naka-bold. Pag category 2, nakagat, may contact definitely, pero hindi dumugo. Or if ever man, nagkasugat, hindi siya dumugo kaagad, pero pinindot mo, that's considered category 2. But if that particular wounds happens in the head and neck area, it's reclassified as category 3. Okay? So, ano yung kailangan mong tandaan for category 3? Spontaneous bleeding. Always ko tinatanong kapag nasa ER, ma'am, have you noticed na after bang kagatin, dumugo ka agad kahit hindi nyo pa siya pinisil? Ayan. Pag sasabihin, yes po, doc, bigyan mo na kaagad ng 2. Okay? It's your active and passive vaccination. But naka-italicized for me here, licks on broken skin or mucous membrane. Ano ba yung considered natin na mucous membranes? Those are your eyes, mouth, and the genital area. Yun yung mga exposed mucous membranes in the body. So, sinerch ko, curious talaga ako, what if dinilaan ka ng aso mo sa mata? Actually, they said technically it's category 3. So, be careful about those kinds of things. What if kinikiss mo yung aso mo every time? Yun actually yung pumasok sa utak ko talaga. What if kinikiss mo yung aso mo every time? Your mouth is a mucous membrane and then bigla kang dinilaan ng aso mo nung kinis mo siya. Diba? Medyo weird isipin. Pero, technically, that's your category 3, ha? So, kunyari, yung patient, nag-kiss niya yung aso niya, then nagtanong siya sa'yo na nadalaan daw siya ng aso niya sa bunganga or sa mata, you give both to the patient. Because technically, that's category 3. And correctly, it should be category 3 because it's licks on broken skin or mucous membranes. Okay? So, yan lang. The rest, kailangan mo lang siya ng wash for all of these categories. Yan. Wash, wash, and then wash. Then no vaccine, active vaccine for category 2, both active and passive for category 3. Okay? So ano ba yung usual na binibigay? Day 0, 3, 7, and then 14 to 28. Okay? Depende na. 4 doses yung usually binibigay. So 0, 3, 7, 14 to 28. Depende. So, bakit ino-emit yung day 28 madalas? Kasi usually, pet dog naman yung kumakagat. So, buhay yung pet mo after the 14-day observation. Okay? Or kahit namatay yan, pero na-confirm nila sa lab na hindi naman siya, wala siyang rabies. So, omit pa rin yung day 28. Kaya usually 4 doses. Pero bakit? A yung always follow kasi naman wala naman tayo masyadong testing for rabies in the country. Okay? Unless may symptomatic na talaga yan. Because rabies is 100% deadly. Okay. Next, number 10. May answer na kagad. I'm so sorry for this one. But I think fast, ano lang naman siya? Common case. Okay. Okay, sige, 20 seconds is up. So here, you can see na it's Coxsackie because this is a case of hand, foot, mouth disease. So I'm happy that letter D, 97% got it correctly. Okay, ending to after that medyo confusing na questions a while ago. So hopefully na-stimulate kayo for today as we end this particular Quizmaster. So hindi ko alam kung anong trip nung dalawa na nag-answer ng letter B. Para maiba. Sige, it's okay with me. Basta in the board exams, do not answer letter B if the case is like this one. Okay? So the case, meron siyang vesicular rash. Saan? Sa kamay, sa paa, and dinagdag sa bunganga pa. Ayan. Pag yan, hindi pa mapansin, that's already hand, foot, mouth disease. Okay? But to be honest, in the community, paminsan, hindi mo yan maiisip kaagad. But if you're aware, and nakakita ka ng patient mo for the first time na hand, foot, mouth disease, you'll never forget because very characteristic. Okay, I would just like to show this one to end this Quizmaster. The things that you need to remember. So these are the erythemas in children. So as you can see here, the first disease is your measles. Hints, high fever, then yung rash, same time sila. Yan, nilagay ko same time. Then yung 3 Cs with the Koplik spots. Okay, yung iba 4 Cs daw kasi kasama yung Koplik spots, ginagawa nilang C. Okay, and then second is scarlet fever. Differentiating, painful daw yung lymph nodes niyan in comparison to your Kawasaki's. Okay? Kasi sino ba yung may strawberry tongue din? Kawasaki disease. Differentiating it, painless kapag Kawasaki disease. Okay? Then rubella, German measles, it has your post-auricular lymph nodes dito. Okay? But I want to highlight here yung palatandaan ko for measles and German measles. Ano ba yung agent for measles? Rubiola, single L. So single word lang siya, measles, di ba? Ano ba yung causative agent ng German measles? Rubella. It's double L. So double word, German measles. So hopefully do not confuse it. Hindi kayo ma-confuse with that kind of mnemonic na kapag rubiola, single L, dapat single word. Pag rubella, double L, 2 word siya. Okay? So German measles. So your German measles is also known as the 3-day measles. Then parvovirus, parv. 1, 2, 3, 4, parv. Okay? Parvovirus, slap cheek. Alright? So, hopefully that helps. And then, HHV6 for roseola, 3-day fever. Madaming nagkakaganito na patient. Like, nilalagnat, papakonsult kasi kinakabahan yung parents. Bakit daw sobrang taas? Then, tinanong mo, nung nawala po ba yung lagnat? Nagka-rash? Ayun. Roseola na siya. Okay? Then, lastly, the one that we asked a while ago, Coxsackie, hand-foot-mouth disease. Vesicles in the palm, soles, and mouth. Then chickenpox, you can see that as vesicular with different lesions in different stages. Okay, so that ends the Quizmaster session for today. Thank you so much for having me here with everyone. So if you have clarifications, here's my contact details. Thank you so much, guys.
Okay, thank you so much, Doc Neil. Doc Neil, however, may mga clarifications here.
Okay,
So, the first topic is about syphilis, yung first na question natin. Kasi you mentioned a while ago that the test for syphilis is NAAT. If we are asked in the exam what test to do to diagnose, should we pick that or dark field microscopy? NAAT versus dark field microscopy.
It depends if depending on the choices that you were given, if nilagay doon kung anong stage, like meron ba siyang lesions, dark field microscopy is a better answer kasi pwede mong kunin yung specimen from that one. Okay?
Okay, so another one for question number 7. How to differentiate capillaria eggs on stool exam versus trichuris egg on stool exam?
Actually, that's a good question. It's a different, actually, there's, nahihirapan din silang i-differentiate yun in actual setting kasi almost similar yung itsura nila. So I'm not exactly sure if I'll try to search for that one, if what other procedures they're doing to differentiate the two diseases. Okay?
So for question number 8, di po ba sporogonic din po would also be bypassed in blood transfusion?
Okay. Actually, it's asking more in the human stage kasi 'di ba malaria is in humans yung ating point of view. So in humans, ano yung stage na hindi siya nadadaanan. But if you think of sporogony, it's in the mosquito stage. So kunyari, it entered the body through blood transfusion. After the blood transfusion, dumaan siya ng erythrocytic stage na infect yung red blood cells, and then it made gametes, the micro and macro gametes. Those micro and macro gametes can still be taken by your mosquito and enter the sporogonic stage. But definitely, your starting point already has been bypassed, which is your liver stage or your hepatic stage of the malaria life cycle. That's all.
Okay, another question, another follow-up. So yung bypass po ba, Doc, nung exoerythrocytic stage will be the same for Vivax and Ovale?
Bypass, you mean from the liver?
Bypass ng exoerythrocytic. Same ba sila?
It's different because yung sa ano kasi, yung sa Vivax and Ovale, they are already deposited in the liver. So definitely they will have a liver stage coming from the hypnozoites.
Okay. Thank you so much, Doc. So I hope everyone is clear with yung mga questions na nasagot natin. And for Doc Neil, may question ako. No? So you just took your board exam noong October 2022.
Yes,
so
sir.
however, dun sa PLE kasi ang concern nila, what to bring? Can you give them yung guidelines? Like, pwede ba bang magdala ng reviewers? Kasi di ba may guidelines sa PRC, yung calculator, dapat ganito lang. How about the reviewers?
For me, the reviewers, I discourage bringing any reviewers in the board exams because that might affect yung ano mo, standing. But I saw few of my batchmates bringing one. So you can still bring, but wag naman yung buong ano mo. And make sure to keep it inside your bag if the proctor says so. They were able to bring reviewers in the board exams. But ang masuggest ko, if you want to bring one, use your mobile phones na lang para if ever you have to turn it off and they won't have any questions whether you used your phone. Kasi baka sabihin nila you brought it out and everything, or even though you did not use your phone, you had a paper with you that may make them think na kodigo mo yon. So better to be on the safe side. You can bring, but best if it's easily tucked out na pwede mo siyang itago once you're instructed by the proctor. And the things that we brought at that time was ano lang, yung clear folder with your confirmation, yung slip na binibigay nila. And then and then yung I don't know if the vax certificate is still included, but at our time it was required yung vax cert, and then an identification ID. They asked us to remove our mask temporarily at the time, briefly lang, para mamukhaan na kami talaga yung nasa slip na binigay nila. So for me, regarding the handouts, you can bring, yes, but not too bulky ones. Safest yung sa electronic devices nyo lang so that you can place them aside if you're given the instruction already.
So, kasi clear yung ilalagyan.
Going to give you a panel discussion discussing what to do on the actual board exam days. So I'm going to give that one day before your boards. Question lang, Dr. Neil, you took the boards no October 2022, right?
Yes, Buddha.
Pwede ba kayong mag-aral talaga? Yun yung alam ko, nagbabari depende sa location. Pwede ba kayong mag-aral during the breaks?
During the breaks namin,
Yung, I think 1 to 2 na breaks. Were you able to, is it legal
personally,
for you to, pinayagan kayo? Hindi.
ang alam ko, Doc, yung sa amin, hindi kami pinayagan. And depends talaga sa proctor if super strict. But ayun na nga, to be on the safe side, para hindi masayang review mo for the past, 2-3 months, better not risk it na lang na mag-review ka pa in between. That's my, personal opinion.
Were
But
you
if
allowed to go out of the venue? Like, alimbawa, gustong manigarilyo, gustong...
no po, we weren't allowed by our proctor at that time.
So, basically, for the entire day, yun yung medyo napansin ko, tinatanong ko kasi titingnan ko kung iba-iba per site. So, more or less, in your site, where did you took your boards?
I had it in Ayala Cloverleaf po, sa cinema ng Ayala.
Yeah, kaya yung batch na may sinehan.
Yes, Doc. Wala na po ba sila this time, Doc?
Okay, so hindi kayo pinayagan lumabas ng venue.
Ng venue, not allowed.
Okay.
CR break lang po talaga yung namin, Doc. Yung opportunity to go out of the class, of the cinema.
Okay. So that's it. So thank you, Dr. Neil. That was a good Quizmaster session. I'd like to address some of the students are already asking me, Doc, sino po yung mga magtuturo sa PEARLS, ganito, ganyan. Okay, once again, I'll give you a formal orientation on October 9, one day before your PEARLS. But basically, sige, the lineup is Biochem will be Ronnie Baticolon and Prince Rubio. Anatomy PEARLS will be entirely by Ernest Calasanz, yung ortho na nagbigay ng extremities lecture nyo sa anatomy. Micro will be purely John Borbe, the one who give your main lecture sa micro. Fisha, wala kayong choice, ako lang. Legal Med, okay, will be given by Dr. Jed Llanes. I want a different perspective from the Rebosa brothers. So ang PEARLS ng Legal Med is si Jed Llanes ang gagawa. Siya gumawa ng handout nyo. Pato will be Dr. Abisamis and also Dr. Jed Llanes. So Dr. Abisamis is a pathologist. He'll be discussing yung clinicals, and then si Jed will be discussing yung basics. You can add a microfacial legal med pato. Pharma will be purely by Dr. Mads Abraham. Surgery will be purely by Dr. Magubat. Okay. Pharma Surge IM. Pharma Surge IM will be 2 teachers. One will be Dr. Carl Avilo, and the other one will be Dr. Harold Chu. So these are your previous lectures then sa IM. Pharma Surge IM. OB will be Dr. Nina Banzuela and Dr. Ana Cruz. And then there's a bonus lecture given by Dr. Shane Fakutagana, as previously announced. Microfacial ligament pato, Pharma Surge IM. OB. Pedia will be purely by Dr. Ian De Vera. And then PrevMed will be by Dr. Lelaine Chongson. So that will be our lineup. Okay. Iba-iba kami ng styles, guys. Baka if you've noticed, kahit naman dun sa main lectures natin, ang style ko sa physio, iba kay Dr. Ronnie Baticolon for Biochem, iba kay Dr. Antonio for Surge. So dito sa PEARLS natin, iba-iba din siya, but it basically follows yung format na question and answer siya. May mindset na, yun nga, you're reinforcing the top 20% most essential portions ng main handout. Okay? So kung paano mo gagawin yung top 20% na yun, so a little bit of Q&A, a little bit of summary tables. It will vary. We allow academic freedom in that scenario for each of the teachers to do it according to their subjects. We'll be releasing the handouts as soon as we can. So, guys, nirequest ko na yan. Kung commerce sa mga estudyante, mas commerce kasi minsan talaga yung mga teachers. Ino-OC nila hanggang kailangan na talaga. Super deadline na. So, we're going to release them as soon as we can. Once we have it, i-announce din naman sa portal yan. The video lectures, hindi pa nagsushoot, most of the teachers, ako pala yung nakakapag-shoot. I'll upload my video, Pearl's video lecture early para makita nyo kung anong itsura. Magkaroon din kayo ng konting preview. So we'll try to upload it by, tapos na eh. We'll try to upload it by today or by tomorrow. Tinitingnan na lang nila, nagpa-final check na lang sila. Okay? One student asked me, Doc, why did you recommend na once lang namin papasadahan ng Pearls? Why can't we read it twice? Of course, you can read it twice. Yung elective, di ba may elective period na nga sa top notch yung after finals nyo? But for most students, majority of the students, I would recommend you go to the Pearls just once. What's the logic behind it though? Guys, ang mother text pa rin ninyo, ang babalik-babalikan pa rin ninyo should be the main handout. Okay? So, pag natapos that's what I will do. Pag natapos yung Pearls, ganito yung scenario guys, imagine it with me. 6 days, pinukpok kayo ng 12 subjects, lecture, video, and handout. So it will give you a very good overview of basically the entire networks, all the 12 subjects. Then after that, finals, then 3 days before the day 1, and then may another 5 days kayo between day 2 and day 3 of the networks. During that time, mas gusto kong balik-balikan yun. Just get glimpses. You don't need to do a proper 3rd or 4th reading of the main handout. Just glimpse certain parts of the main handout. Okay, try to identify what we call knowledge gaps. Yung tipong, Doc, hindi ko pa talaga kabisado to, gusto kong balikan. Yun yung sisilip-silipin mo dun sa main handout. Then ngayon, dadagdagan mo na lang yan ng mga buzzwords natin, yung mga flashcards, yung mga bonus lectures natin. It will vary depending on your context. But guys, that's my personal recommendation regarding Pearls. So go through it once. Okay? Pag natapos ka makinig ng lecture, na-highlightan mo na, hindi na-highlightan, na-red ball penan mo na yung buong handout. So ang babalik-balikan, hindi yung mistress. Consider the Pearls as the mistress. Ang babalikan mo talaga is the main handout, yung legal wife. Sorry for the analogy, okay? Ibalikan doon sa main. Huwag mong babalikan yung super summary. The Pearls is basically a super summary. Balik ka dun sa main handout, get glimpses. Okay? So thank you so much once again. Thank you so much, Neil. Very good work. Thank you so much, Kimi.
Thank you so much, Doc Bradley. Thank you so much, Doc Neil. So guys, you may meet with your respective MGs. So for my BBGs, stay here sa Zoom natin. Thank you. Thank you so much. Good morning, everyone.